today's class. So nutrition and infection, it's kind of a vicious cycle. Okay, when you are infected, when you are low on health, okay, not doing well, definitely you will not feel like having food. On top of that, when you're not having food, you're not having enough nutrition, you have higher chances of getting infected. So it's like a vicious cycle. So malnutrition, that is not adequate nutrition, okay, you're not having good amount of foods, fluids, vitamins, minerals, macro, micro, everything. Okay, so malnutrition will lead to increased catabolism. Does anyone remember what is catabolism? Anyone, do you have any idea what do you mean by this medical terminology called catabolism? Yes, catabolism means breakdown. Breakdown of what here? Increased catabolism in the body. Breakdown of what? In malnutrition, what is breaking down too much? Catabolism. Breakdown of what? Breakdown of the nutrients that your body has stored for future use. Okay? Breakdown of the nutrients your body has stored for future use. Okay, when you're malnourished, your body increases the utilization of those the nutrients that your liver have stored, that your skin has stored in terms of protein as well as fat, muscle have stored protein as well as glucose. Okay, all these things will be broken down for the body's consumption, and for the future there will be no nutrients left. That is increased metabolism. Then malabsorption, issues with your digestive system, decreased nutrient intake. Okay, when you're malnourished, if you have other disorders as well, okay, which came from malnourishment, you will not feel like having more food. Okay, now because of all these reasons, you are at a higher risk of getting an infection. And when, just imagine a person is infected, okay, malnourished or not malnourished, even if a healthy person is infected or a malnourished person is infected, they will have an impaired barrier protection. Barrier protection means your mucus that you secrete through through your nose, okay, from your digestive system, okay, the gastric acids that are secreted, okay, your villi that you have in your lungs as well as in your intestine, these all are your barrier protectors. Okay, your skin is a barrier protector. Okay, so you will have impaired function of barrier protection throughout your body. Along with that, impaired immune function. When you're already infected, we know that your immunity is low, your immunity was not strong enough to fight off the infection, so you got the infection. On top of that, when your WBCs, white blood cells, antibodies are fighting off the infection, okay, you will be in an impaired immunity situation. Since you're already in impaired immunity situation, you got the infection. Okay, so this is a vicious cycle of nutrition and infection. Malnourishment can lead to higher chances of infection. Being always infected, okay, being always infected, being always encountering various kind of infections over and over again could lead to malnourishment. Okay, so next we have immunity, immune response. What are the different types of immunity which we have? Okay, so first is your innate immunity and adaptive immunity or acquired immunity. Sometimes, usually we use the term acquired immunity, okay, instead of adaptive. So innate means what? It is already present in your body by birth. You have it. Nobody has to give your body innate immunity. It's already there as you take birth. Okay, so under innate immunity you have humoral and cellular. Okay, humoral is the cytokines and complementary cytokines and all that. Cytokines will do the phagocytosis, etc. Okay, cytokines will lead to phagocytosis. They eat up your bacteria or any foreign object or virus that enters your body. Okay, and then you have cellular immunity, your macrophages in your WBC. Okay, granulocytes, WBC, basophils, another form of WBC, mast cells, dendritic cells in your brain, okay, NK cells, etc. Most of your WBCs are of different types. Okay, there is not just one particular kind of white blood cells. There are different types of white blood cells. So macrophages, granulocytes, basophils, eosinophils, neutrophils. Okay, there are different kinds of WBCs. we don't have to go into deeper into it. Okay, eosinophils and basophils are usually related to allergic reactions. Neutrophils and other granulocytes, macrophages are related to treating eating of the infectious bacteria, etc. Okay, so humoral and cellular immunity, you are born with it. As a child is born with blood has WBC, so the child is born with innate immunity. Also your the stomach acids that is produced, okay, hydrochloric acid that is produced in the stomach, that is also a part of innate immunity. Okay, your the mother is not giving hydrochloric acid to the child. Okay, the child is born with that, so that is an innate immunity. Resistance of your skin, okay, the skin's barrier, pH barrier, and the skin's natural barrier, okay, that fights off the infection, that not doesn't allow the bacteria to grow, that also is an innate immunity. Okay, next, coming to adaptive immunity, or also called as acquired. In your textbook we have given it as acquired immunity. Okay, and acquired also you have humoral and cellular. So in from humoral you will get all the antibodies. Okay, humoral from where do you get the humoral? It's from your liver, your bone marrow. Okay, they make the humoral immunity, they will make your antibodies. Okay, cellular is from the thymus gland as well as the bone marrow. Okay, T lymphocytes and B lymphocytes. From the thymus glands, the lymphocytes which are produced, we call it as T lymphocytes. From the bone marrow, the lymphocytes that are produced, we call it as the B lymphocytes. Okay, so this is adaptive. How do you get this acquired immunity? See, antibodies. Antibodies usually. Can you give me an example, like how antibodies are formed? Anyone from the medical background? Okay, a child is born. Okay, the child is usually not born with antibodies apart from the ones that has been passed from the mother's umbilical cord to the child. Okay, apart from that, that is during the fetal life. But after the fetal life is over, the child is born. From where will the child get antibodies? Yeah, vaccination, then past infection, yes, and something main, a very main thing that is a part of the child's nutrition, colostrum. Okay, colostrum, the mother's breastfeeding, the mother's milk. Okay, so these are the, so this is the types of antibodies that is given to the child. The child is not making it on its own, it is given to the child. It is given to the child either by encountering an infection or encountering a live attenuated virus through vaccination, or from mother's breast milk that the child ingests. Okay, so it is given to the child. So it is acquired. The child acquires it from some other source. Okay, so that's how antibodies are made in a human body. Okay, and cellular level, T lymphocytes and B lymphocytes are made as soon as an antigen hits the body of the child. Okay, these T lymphocytes, the B lymphocytes will fight, but they will also register. Okay, it will also be registered in the child's immune system. That, for example, chicken pox. If a child encounters chicken pox, there are very rare cases of second encounters of chicken pox. Okay, because why? The immunity registers that information. Okay, once the immunity knows how to defend itself, defend the human body from this particular bacteria or virus, it's kind of a natural immunity that it will be carried out throughout the rest of the child's life. Okay, so acquired immunity in detail, the immunity that develops during your lifetime. So you have active immunity and passive immunity under acquired. So under active immunity, it develops in response to an infection or vaccination. Okay, passive is what is passed on to the child, which is given to the child. Okay, active immunity, it stays active because we only, even if you are giving vaccination purposefully to the child, okay, that vaccination is something foreign to the child. Okay, so the body gets the immunity gets activated. Okay, the immunity gets activated only in the presence of an antigen. The immunity gets activated, so we call it as an active immunity. Okay, either it may be through an infection or through vaccination. Okay, so under infection and vaccination, we have natural. Natural is the antibodies responsive, which are produced as in a response to an infection that naturally takes place. Okay, nobody is infecting the child purposefully. Because of the environmental factor, the child has encountered an infection on as a natural course of its life, and the antibodies is produced. In artificial, we are artificially inducing an infection in the child through vaccination. Okay, live attenuated or attenuated virus. Okay, vaccination is given, that is artificial. Okay, which is synthetic, which is made in the laboratory and then given to the child. So in both the cases, an infection is activated inside the body, the antibodies will get produced. So that is active immunity. Passive is what we are passing on to the child. It is given purposefully to the child. Okay, develops after you receive antibodies from someone else or somewhere else. So natural antibodies through mother's breast milk, it's natural source of antibodies. Then another artificial form of antibodies that you get from someone else is IgE vaccinations. Okay, the injections in which you are not given antibodies. Okay, the injections in which you are not given any bacteria or virus. Okay, in artificial this Ig injections. Okay, immunoglobulin. Ig means immunoglobulin injection. You are getting the antibodies of a person who was infected by a certain infection. Okay, we take their plasma, we separate the antibodies from that plasma, make it into an injection, and give this ready-made antibodies from somebody else's body to someone else. Okay, so that is Ig injection, immunoglobulin injection. So that is the difference between vaccination and Ig infection. Okay, Ig injection. In vaccination, you are just introducing the causative agent. You are introducing the antigen. You are introducing the causative agent into the body. Okay, but in injection, you are not introducing the antigen or causative agent into the body. You are introducing directly the antibodies into a person's body. Okay, so that's the difference between artificial active immunity and artificial passive immunity. Is it clear to all? Is it clear to all this particular slide? The difference between active immunity, passive immunity? Okay. So this could be a bit tough and bit confusing for people who are from commerce background. If you require any further clarification, so please contact me personally. I will explain it again. Okay, if I do it again here, we will be wasting the time of others who already know these facts. Okay. So nutritionally relevant infection or infestation, bacteria in TB, tuberculosis, whooping cough, infective diarrhea, enteric fever. Enteric fever means anything, any infection to your intestine. Okay, rheumatoid arthritis, pneumonia, tonsillitis. Okay, what happens in all these infections which we have mentioned? Just let's take an example of TB. Okay, anyone from the medical background who have observed a TB patient over a period of time. Okay, from the time they have contracted TB and they have progressive TB, okay, for the next few months or so, what changes do you see in this person? Anyone from the medical background, if you have witnessed a TB patient, nutritionally, what changes you see in the person, which is very much evident? It's better if you do not use the terminologies like cachexia, because there are students who are not from the medical background. They may not understand the meaning of it. It's better to use simpler English language for. Cachexia means increased amount of weight loss through muscle wasting. Okay. Yeah, cough is there. Cough is a part of symptom, but nutritionally, I'm asking about nutritionally what symptom you will see. So that is weight loss. Pramila Singh has mentioned weight loss. Okay, the exact term, medical terminology is cachexia, but that is something that commerce students who are here right now, they will not understand. Okay, so cachexia, when you convert that into a simpler language, it is too much of muscle wasting. Okay, muscle wasting means what? It's not just fat loss. Okay, muscle wasting, you will lose a lot of weight. Definitely, when you contract TB, you will lose a lot of weight. But this weight loss, it's not just your fat loss. You are losing your lean muscle mass also. Okay, so weight loss has two kind of weight loss. Like you may be losing your water weight, fat or protein. Okay, so what happens here is that all kind of weight loss will take place. Okay, the patient will not just lose the fat from their body, they will also lose the entire protein content from their muscles. They will lose their lean muscle mass. Okay, so that is cachexia. So these are nutritionally relevant. The same thing will happen. The same cachexia kind of muscle wasting, fat loss, okay, weight loss, and becoming too weak nutritionally, that it affects your diet. Okay, all the infection, bacterial infection, that will definitely affect your diet. Will not give you an appetite to eat anything, and even if you get an appetite, this particular infections will not allow your intestine to absorb nutrients. So those infections are mentioned on the screen. Bacterial infections are mentioned on the screen. Okay, then viral, you have measles, common cold, influenza, pneumonia, diarrhea, chicken pox. Okay, they will also have a similar effect. Parasitic infection, malaria. Okay, not just malaria, but more than in malaria, you will see in malaria your appetite will come back eventually within 2 or 3 days. But anyone who have suffered from dengue and malaria, if anyone there is there in this class who has suffered from dengue and malaria, okay, or chikungunya even, okay, can you, if anyone has suffered, so please say that you have suffered and just explain the differences what you have seen in both the conditions. Okay, where did you lose your appetite a lot? Was it in malaria or was it in dengue? Has anyone suffered from both the conditions? It could be subjective as well. The way how symptoms, clinical symptoms have caught you, it could be very subjective also. So usually we have seen this in patients who have malaria and dengue. Loss of appetite is prolonged in the conditions of dengue. Okay, in malaria, your appetite definitely comes back within 2 to 3 days. Okay, but in dengue, even after your platelets count and everything comes up, but you still do not get back your appetite. Okay, so that's one issue we have seen in dengue. It is not mentioned here. Okay, so malaria, dengue, helminthes infections is all your worm infestation. You have this intestinal worm infestation, no? Ascariasis, ankylostomasiasis, okay, hookworm infestation, tapeworm infestation. Okay, so all these are helminthes infections. Okay, worm infection, we call it as an helminthes infection generally in medical language. Okay, so worm infestation, obviously, whatever food you have, these parasites in your stomach or in your intestine will just steal your nutrients. Okay, depriving the human body out of nutrients. Okay, that's how it leads to nutritionally ill, weak person when we contract these kind of infestations. So next, effect of malnutrition on infection. First is SAM. What is the full form of SAM? It was our previous class. What is the full form of SAM? And give 2 examples of commonly seen SAM conditions. Please be very careful about the abbreviations wherever you see. Whenever you come across any abbreviations, please underline that. Okay, a lot of questions from abbreviation point of view will be asked, so please be careful about that. Also give me 2 examples, any 2 examples of severe acute malnutrition. Yes, marasmus and kwashiorkor. Okay, from marasmus and kwashiorkor, which belongs to an elder child, which is usually seen in an elder child and which is seen in toddlers or infants? Yes, kwashiorkor is a protein energy malnutrition, which is commonly seen in children above the age of 3. Okay, and marasmus is usually seen in toddlers and infants. Okay, so SAM is severe acute malnutrition. Okay, protein energy malnutrition. But when you're talking about protein energy malnutrition, we're talking about protein and carbohydrates as well as fat. Okay. So SAM is an effect of a severe condition of malnutrition. Then we have vitamin A deficiency. What happens in a vitamin A deficiency? Which organ will be affected the most? And why is it so important to correct vitamin A deficiency as soon as possible? Yes, it can lead to blindness. Okay, vitamin A deficiency definitely affects the eyes of the children. It definitely can lead to blindness. Okay, if not corrected properly. Okay, so we have national programs for vitamin A deficiency. When we'll come to the chapter on vitamin A in nutrition science in this textbook itself. Okay, in one of the chapter we have an entire 1 hour segment, two segments. There are one segment is just about vitamin A, another hour will be about the deficiencies of vitamin A. Okay, so in detail we will discuss about vitamin A then. Okay, so in both the conditions your lymphocytes, your immune system is very low. Okay, it affects obviously the severe acute malnutrition. No, let's see about blindness. Okay, when we talk about blindness because of vitamin A, it's a spectrum. It starts with night blindness. Okay, it starts with night blindness, xerophthalmia. Okay, then it progresses viciously and leads to complete scarring of the cornea and pupil of the eye. Okay, we'll discuss each of these categories, each of different categories of blindness that is progressive because of vitamin A deficiency. We'll discuss that in detail in that class of vitamin A deficiencies. Okay. So in both these conditions, your lymphocytes and your immune system is severely affected. Okay. See, because see your immunoglobulins, if you have to if you have to produce immunoglobulins, okay, immunoglobulins, which macronutrient you require? Immunoglobulins. Immunoglobulins means antibodies. Your body has to produce antibodies, immunoglobulins. The word globulins have come in. What macronutrient you will require? Proteins. Definitely, yes, protein, correct answer. So in severe acute malnutrition, the body is completely malnourished out of protein. Will they be able to make immunoglobulins? Will they have enough amount of immunity left with them? Or whatever is left, it will be consumed up. Okay, so that's how SAM affects the immunity. Okay, vitamin A also, your T lymphocytes, helper T cells will be affected because of vitamin A deficiency, because vitamin A is required in your bone marrow also. Then coming to vitamin C deficiency, I guess we all know the importance of vitamin C. Why do we require vitamin C in our diet? Can anyone just give one major function of vitamin C in our body? Vitamin C, any of your vitamins will not give you energy. Okay. Please don't be confused in that. Energy will not be provided by vitamins or minerals. Okay. Vitamin C is a really great antioxidant. Okay. Yeah, vitamin C is a really great antioxidant. It can see your free radicals now. Your free radicals can also go and attack your immune cells. Okay, it can attack your lymphocytes. If you have too much of free radicals circulating in your body, it can definitely go and attack your lymphocytes, your barrier, the barrier immunity that you have, innate immunity that you have already in your body as a part of your tissue. Okay, free radicals can go and attack that, go and destroy that. But in the presence of vitamin C, that distress is reduced. Okay, so that's also another way of how Vitamin C helps you cope up with low immunity. Okay, so that's the reason why when we had this COVID cases on high alert and all, vitamin C, citrus fruits, okay, vitamin C tablets and all that, like it was just selling off from the pharmacies like hotcakes. Okay, yeah, healing wounds also. Why vitamin C leads to heal wound? Because it boosts your collagen. Okay, collagen will lead to increased amount of scarring tissue that has to be formed to close the wound. Okay, and once the wound is closed, your skin barrier is repaired. Okay, a wound means what? There is a cut in your barrier system, in your skin's barrier system. Okay, so skin is also a part of your immunity. Okay, because it gives you barrier. Yeah, zinc is also important, but see, if you follow a balanced diet, you do not require zinc tablets or zinc as a mineral to be added into your diet. Okay, most of the pulses, legumes, and cereals, what we have, okay, what we have in our regular diet, we it is more than enough to supplement you the amount of zinc that you require. Okay, but if you do not have a balanced diet, you have a very nutrient deficient diet. Only then we recommend uh, the clients to go for multivitamins, etc., focusing more on zinc. Okay, so that's how vitamin C helps you. Yeah, it's largely because when a person suffers from COVID, okay, their appetite is largely influenced. Once, see, in COVID, one of the classical symptom is that you lose your taste, you lose your appetite. If you lose your appetite, how are you going to eat? Okay, if you do not eat, how are you going to satisfy your body with microminerals and vitamins? Okay, so giving a combination of these two, okay, it was quite essential. Okay, it served the purpose of immunity as well as the nutritional demands. Next, iron deficiency. So iron deficiency, your RBCs and the bone marrow will not function properly. Lymphocytes and neutrophils will not be formed enough. Okay, so because of this, any infections very similar to tetanus toxoid or herpes antigens and all, okay, it's very commonly contracted by people who are low in iron, those who are anemic. Okay, anemic, if they even if they have taken TT vaccine, okay, usually the TT vaccine will not work on them if they contract the tetanus toxoid infection or herpes simplex infection. Okay, if you're anemic, you can easily get these infection. Tetanus toxoid cases are quite rare nowadays, it's very rare. Okay, because TT infection is given, TT injections, vaccination is given, it's not injection, it's vaccination. TT vaccine is given as a part of the universal immunization schedule. Okay, so we do not see TT cases anymore. Okay, it's quite rare, but still those who are anemic, those who are deficient in iron, okay, they have higher chances of contracting such rare infections also. Okay, zinc deficiency. Zinc will cause the atrophy of your lymphoid tissue. Lymphoid tissue is found in your lymph nodes, your thymus gland. Okay, here and all you will find lymphoid tissues. And if the lymphoid tissue is making lymphocyte. Okay, lymphoid tissue is making lymphocyte. If lymphoid tissue undergoes atrophy, what do you mean by atrophy? People from the medical background, you can say, what do you mean by atrophy? Any tissue or any part of your body is undergoing atrophy. What do you mean by that? It's not thinning, it's shrinking. It becomes smaller in size. Okay. The number of cells will also reduce. The size will also reduce. Okay, so that is atrophy. Okay, so when the lymphoid tissue, a healthy lymphoid tissue, decreases in its size, it becomes smaller and smaller. Obviously, the amount of lymphocytes produced by this lymphoid tissue will also be quite low. Okay, so instead of producing 1 million lymphocytes in your body, this lymph tissue will be producing only few lakhs or something like that. It definitely affects your immunity. Okay, so that's why we give zinc tablets. Now the effect of infection on nutritional status. Okay, what we have discussed so far is if you have certain deficiencies, how it will affect your immunity. Okay, but now what we are going to discuss, you already have an infection. Okay, you are already infected. How is this infection going to affect your nutritional status? Okay, so first is protein catabolism and negative nitrogen balance. Negative nitrogen balance is seen whenever you undergo any surgery, too much of blood loss, okay, burns patients, okay, in burns patients and all, we see this negative nitrogen balance. Why nitrogen balance? Why we discuss about nitrogen balance here? Because protein is the only macronutrient when we compare it to fat, lipids, and carbohydrates. Protein is the only macronutrient which has this amino group to it. Amino group, it is a nitrogen based group to its skeletal structure. Okay, in organic chemistry, that's how we classify protein as. Okay, they have this nitrogen based amino group attached to it. So that is the reason why we get amino acids. We break down protein and we get amino acids. Okay, it's nitrogen based, smaller chunks of broken down parts of protein. Okay, so when you have a negative nitrogen balance, okay, your wound healing affects, okay, your respiration, it also gets affected, your general health gets affected if you do not have a good nitrogen balance within your body. Even when you are expiring, okay, like for example, when you're exhaling air, okay, along with carbon dioxide and oxygen, you expire a whole lot of nitrogen as well back into the environment. Okay, so protein helps to create a good nitrogen balance within your body. If you are breaking down a lot of protein, okay, a lot of protein is being broken down by the body, a whole lot of nitrogen will also be released out by the body. The body will not be securing enough nitrogen to be kept inside and utilized for later. Okay, so that's how protein catabolism affects the body. Okay, then depletion of carbohydrates. CHO means carbohydrates. Okay, depletion of carbohydrate store. Where and all is carbohydrate stored in your body? Carbohydrate stored in the storage in form of, how is it stored? Is it stored in the form of glucose or something else? And where and all it is stored? Carbohydrates. Yes, glycogen in liver as well as in your muscles. Okay, not just in your liver, it's also stored in the form of glycogen in muscles. Okay. So yeah, depletion of glycogen stores from livers as well as muscles. Okay, and it will increase your resting energy metabolism. Resting energy metabolism means what? You're not doing any work. Okay, you're just laying on your bed, you're sitting on laptop, computer, whatever you're doing, just sitting, you're not moving much, you're not moving around, but still your body undergoes metabolism. Okay, your body is still digesting things that you have had, even if you're not moving around, not walking around, whatever you had had, breakfast, lunch, or snacks, something, okay, your body is continuously breaking it down. Okay, even without any physical activity that you have put out, your body can still break things down. That is your resting energy metabolism. So depletion of carbohydrate store when you're infected. Okay, when you just imagine a situation when uh, let's say somebody is suffering from typhoid. Okay, somebody is suffering from typhoid. Will they lose a lot of weight or not when they recover from typhoid? Will they lose a lot of weight or not? Yes, and when we talk about their weight loss, okay, when we talk about their weight loss, they were resting. Okay, they had low appetite, but still you may manage to keep them feeding, like in form of some clear soup, kanji, khichdi, or something like that, not too heavy, light food also, the food that is rich in carbohydrates. But still, will they gain weight, or they even after feeding them when they were on when they were suffering from typhoid, did they gain weight or did they lose weight? Nobody will be fasting throughout the typhoid uh, infection. Okay, otherwise the person will die off. Okay, you will be feeding the patient with glucose water, Okay, will khichdi, kanji, clear soup, something that is rich in carbohydrates will be continuously given to the typhoid patient. Okay, even after giving carbohydrate rich food, not dense but carbohydrate rich food, okay, the typhoid patient will still lose a lot of weight. Why? Because the metabolism was quite high. When you are having fever, typhoid comes along with fever, the body temperature is increased. When you naturally have your body temperature increased, your body is burning a lot of energy to reach that high temperature. Okay, so that is increased resting metabolism. Okay, and that leads to depletion of your carbohydrate stores. Okay, increased gluconeogenesis. Gluconeogenesis. Okay, when you break down it, gluconeogenesis. Okay, so new glucose is been formed. Okay, from glycogen. Neo means new. Okay, new glucose particles are formed from the stored glycogen. Okay, to give out energy, because the depletion of stores carbohydrate stores is taking place. Glucose is stored in the form of glycogen in liver and muscles. Okay, so when this glycogen has to give out energy, first it has to convert back into glucose. So this glycogen will be converted back with the help of certain enzymes. It will be converted back into glucose, and this glucose will be utilized to keep up the energy demands when you are sick. Okay, so that is gluconeogenesis. That's a biochemistry process that takes place in your body. Okay, whenever you are low on energy, when you have to run, you have to do some work, you do not have enough glucose, the stored glycogen will convert itself into glucose to give you energy. That process is called gluconeogenesis. Okay, so since you do not have an appetite, you're not eating anything when you are sick, but still you require energy for your basal metabolic activities. Okay, for resting also you require energy, your body requires energy. So this gluconeogenesis process will be increased. Okay, hence depleting the carbohydrate stored. Then peripheral insulin resistance. Okay, peripheral insulin means in the it's not it's reversible. Okay, this insulin resistance is definitely reversible. Once you get out of an infection, you will definitely get out of this insulin resistance also. Okay, so what happens here is that how much ever glucose or how much ever carbohydrates you are eating, okay, that will not affect that is not enough to whatever insulin is being reduced is being released to contract this particular high load of carbohydrates. Okay, that insulin will not be accepted by your body cells to come and take out the excess glucose. So that is insulin resistance, but it is reversible. Once you recover from your infection, your insulin resistance will also vanish off. Okay, but there is another form of insulin resistance that leads to diabetes later on in life because of certain hormonal situations that we'll discuss later. Okay, so peripheral insulin resistance is just a simple in a simple way putting out that your body will not accept the function of insulin, that is to bring down the blood glucose level. Okay, your blood glucose level will stay high because continuously your body is giving out glucose to keep up the energy, depleting itself out of the glycogen stores. Okay, to keep up the high energy. Here your insulin will not be able to work or bring down the blood sugar levels. Okay, so that is for that brief period of time you will suffer from insulin resistance, that is peripheral insulin resistance. Altered lipid metabolism. Lipid means fat. Okay, fat metabolism will not take place in a healthy way. You may suffer if you are sick and if you have some fatty foods, okay, fat rich food, you will definitely suffer from stomach related ailments. Okay, so avoid fatty foods or junk food or fat rich food when you suffer from infection, because the lipid metabolism is altered. Okay, your body is not in a situation to break down your fat. Okay, the fat that you give via food. Okay, the lipids that you bring in via foods. So avoid that as much as possible till you get well. Okay, and trace elements like ferrous, your iron, copper, and zinc redistribution takes place as and when it is required, wherever it is required. Increase increased vitamin utilization and excretion. Okay, you even if you eat a lot of fruits and vegetables and minerals during this period of time, your body, since your intestine, small intestine, is not in a situation to absorb all the nutrients, it will definitely discard most of them. Okay. Then effect of infection on nutrients in terms of macronutrients will go in deeper. So now we have discussed about the nutritional status. Now we are just going one by one. Okay, what happens to the protein, carbohydrates, etc. So in protein, your serum albumin levels, etc., will decrease. Okay, the entire protein structure from your body will be getting depleted. Okay, since you're losing your lean muscle mass also during infection, it will get depleted. Even the albumin levels from your serum will get depleted with respect to bacterial or viral infection. Okay. According to vitamin A, the intestinal absorption of vitamin A will be impaired. Even if you have vitamin A rich food during this period of time, and when you are in an infection phase, your intestines will not be able to absorb vitamin. As I have discussed just now recently, intestines will not be able to absorb maximum of the vitamins which whatever you provide when the body is suffering from infection. Okay. B vitamins or the B complex vitamins, thiamine metabolism is affected because of infection. Okay, and there people sometimes may suffer from beriberi, but beriberi is again it's a very rare condition. There is very rare infections that could lead to beriberi. Okay, otherwise nowadays infections are corrected as soon as possible. We do not prolong the infection for pretty long time that the patient goes into the situation of beriberi. Okay, but that's a chronic stage. If you are suffering from a chronic infection, beriberi could just come in later. But if it's an acute infection, nobody suffers from beriberi out of B complex deficiency. Then ascorbic acid, that is vitamin C. Kids who suffer from malaria and all, we have seen that in their blood, okay, there's a marked decrease in the amount of vitamin C. So via food, if we increase it, that's ideal. And whenever there is an influenza or flu or any common cold kind of symptoms among children, we are not sure about adults, where they are not mentioned about adults here, but in children it is seen that kids who have low concentrations of vitamin C in their body, they have a higher risk of getting infected with influenzas. Okay, so having vitamin C rich food could prevent future contractions with flus or any influenza or common colds. Okay, we can't completely avoid it, but we can prevent the number of contractions one may have. Vitamin D, pneumonia can aggravate rickets. Those who are already suffering from rickets, okay, already the kids or adults who are already suffering from rickets, if they contract pneumonia, okay, their rickets will get aggravated. Okay, it doesn't mean that a person who is healthy, a child who is healthy, the child who does not have rickets, once the child gets pneumonia, it will the child will also get rickets. It's not like that. People who already suffer from rickets, that is vitamin D deficiency, and on top of that they get pneumonia, the situation will be aggravated. Okay. Iron, if any child has any worm infestation, okay, hookworm, tapeworm, any helminthic infections, iron stores will come down. Okay, because these worms are usually taking out the blood from the intestine. Okay, they will have low blood levels also. They may turn anemic also if it is not corrected, but with anti-helminthics. And any chronic infection, if it is not treated, it will definitely lead to depletion of iron stores. Okay, and further it will lead to anemia and other blood related disorders. Chronic infections could lead to that. Minerals, the only time when you lose a lot of minerals is when you have issues with kidney, okay, infections that concerns your urinary system and diarrhea and your gastrointestinal system. That is, if you suffer from diarrhea and all. you will definitely lose a lot of minerals out of your body. Okay, so correct it using ORS, okay, or any electrolyte balance therapy. You will be fine. Then lipids, any liver related infections, okay, pneumonia, influenza, okay, it will lead to too much of deposits of fats or lipids on your liver, and it can lead to fatty liver. If not, if the chronic, if we give this acute infection a chance to become chronic, okay, you can definitely get fatty liver as well. So that's the reason why we say that you should avoid having fat dense food when you are suffering from any infection. Okay, we do not want to risk your liver getting the chance of being deposited by fatty acids, and you have a risk of getting fatty liver in the future. So avoid having fat rich food when you're infected. Have lot of carbohydrate dense food. Okay, that's very good, but avoid fat rich food. There is no home remedies. Okay, if for worm infestation, please contact a doctor for this. General physician will also do, and get antihelminthics prescribed. Okay, albendazole, mebendazole, okay, such uh, prescriptions will be given to you. Okay, please do not rely on any home remedies. And get a regular stool check done, because you have to find, because the stool of the usually worm infestation is very rare in adults, it's very common in children, and in some case senior citizens. Okay, in adults it is very rare. So for children, you have to do the stool check done. Okay, fecal analysis done, because if there is any chance of worm infestation, they will lay their eggs, and these eggs are passed through the feces of the child. Okay, so get regular stool examination done. If your child had an history of worm infestation, you have to check up on this on a regular basis. The carbohydrates, low levels of blood glucose level are common in infectious diseases, and it is mainly because you do not have much calorie, you do not have much food, and on top of that, it is depleted. Your glucose and glycogen stores are depleted out. All the enzymes that you produce in your body, okay, definitely in your intestine as well as in other organs, their function becomes altered. They are not as strong as how they were supposed to be. Okay, so that's how infection can affect your enzyme. So that's how infection can also affect the way how you digest, and the way how your body is supposed to absorb food. Okay, even anatomically there may be nothing wrong with your intestine. Okay, anatomically there is nothing wrong with your intestine, but the physiology matters. Okay, physiology, if the physiology of your intestine, the way what it produces, what it secretes, okay, when these things get affected, okay, it will alter the absorption capacity of your intestine. Growth and development, just imagine a scenario where you have come across a child on a weekly basis or on a monthly basis. The child has some or the other infection. Okay, the child is contracting some or the other infection on a monthly basis and sometimes on a weekly basis. What do you think is the impact of this condition on the child's growth and development, according to you? I guess we all know the answer to this, but still you can put it out in a statement here. A child who frequently contracts infection, what do you think will be the effect of such health intolerances on their growth and development? Always remember the vicious cycle, the first slide which I have shown you. There are high chances the child will remain malnourished, and if the child remains malnourished, the child will not have adequate growth and development. Okay, it's not just about losing weight, it's about growth and development. Okay, then malnutrition, we have discussed that recently. All infections, if not corrected properly, could lead to malnourishment. And vicious cycle, the first slide which I have explained to you. Okay, how malnourishment, continuous infections, and malnourishment are interrelated. Okay, one could always lead to other, and the other will keep the other villain in place. Okay, malnourishment will lead to regular contraction of infection, and regular contraction of infection will make sure that the malnourishment doesn't go away. So this is the vicious cycle. Now coming to HIV patients. So in HIV, immunity is impaired. Especially your T lymphocytes and B lymphocytes. What the HIV virus does here is the human immunodeficiency virus. What it does, it goes into your DNA. Okay, it uses this enzyme called reverse transcriptase enzyme, and it converts itself into an RNA. And with the help of this RNA, it is able to make copies of itself. Okay, the HIV virus is able to make copies of itself in the human body. Okay, because it goes to the DNA level of any cell that this virus is infecting. Okay, if an HIV virus enters a person's body, it goes to a specific cell. Okay, any cell that matter, and it goes to the at the DNA level, uses the reverse transcriptase enzyme, converts itself into an RNA. With the help of RNA, now the virus itself is an RNA. So this virus is capable of making multiple copies of itself and infecting the entire body. So these multiple copies of virus will go to the T lymphocytes and B lymphocytes and attack it. Okay, see why T lymphocytes and B lymphocytes getting attacked is a major issue. Do you think we in a human life, okay, those who are from the medical background, they can share. In a human life, do you think we can continuously produce T lymphocytes on a regular basis? Can we produce continuously T lymphocytes on a regular basis till the time we die? One second. Yes, the thymus gland, it gets inactive after a certain age. Okay, it's only active when you are in your childhood. Okay, after that the thymus gland gets inactive. It just remains there as a form of tissue. Okay, once you become an adult, after you cross your later phases of adolescence and all, it is just a tissue uh, in near your throat area. Okay, near your sternum area. That's a function of thymus gland. Your T lymphocytes are produced by the thymus gland. So you will not have a continuous supply of T lymphocytes throughout your life. Okay, so you have this limited supply of thymus T lymphocytes. On top of that, if a person contracts HIV, the HIV virus is going to destroy the T lymphocytes. Okay, which is already in a specific amount that your body has. Okay, so slowly, day by day, a whole lot of T lymphocytes will be destroyed by this HIV virus. Okay, and at the end, what happens? The patient does not even have the immunity to fight off a common cold. Okay, there is no longer T lymphocytes in their circulation. Okay, so that's how HIV affects the immunity. Okay, so malnutrition is also there. Along with that, a frequent fear of getting infection. Okay, that is also there. So malnutrition, what kind of signs and symptoms you can see in an HIV patient? There is a swollen body and feet, skin is pale, okay, eyes, hair, etc. Pale, lack of blood. They're underweight because they also undergo a lot of muscle wasting and they lose a lot of weight, thinness, muscle wasting. Okay, infectious disease, they usually contract diarrhea, tuberculosis. By tuberculosis, in India, it is quite common to see HIV patients along with tuberculosis because the tuberculosis bacilli, Mycobacterium bacilli, is so widespread among our Indian climate, Indian environment. Okay, Mycobacterium tuberculosis bacilli is very widespread. Okay, even if you're sitting in your own home, you have millions of Mycobacterium tuberculi in your home. Okay, and on a daily basis, you're inhaling it and you're exhaling it, but it doesn't affect you because of the BCG vaccine which we have took. And as Indians, we kind of have a natural immunity against common Mycobacterium tuberculosis, not the multi-drug resistant one, okay, but the common ones that are already present in our environment. We have developed a natural immunity against it. Okay, but this natural immunity will also not help the HIV patients at the end. So that's the reason why tuberculosis and HIV is closely related in India. Okay, malaria, pneumonia, common cold, or flu-like symptoms are commonly contracted by the HIV patients. So they will have a lot of micronutrient deficiencies. Macronutrient deficiencies because now if the muscle wasting has started, means the patient is in a macronutrient deficiency phase. Okay, it starts with micronutrient deficiency, but later it transgresses into macronutrient deficiency. Okay, macronutrient deficiency, once it started, means you will see the physical change in the patient. You will see the muscle wasting happening, thinning, coughing, okay, losing the entire fat, and you can see the prominent bone structures, okay, from on the patient. These symptoms will be very prevalent and observable when the patient reaches this macronutrient deficiency stage. Next, coming to the COVID-19 category. First, the major importance what you have to give is the protective equipments, what you wear. Okay, using hand sanitizers regularly, washing your hands, using barrier protection like mask, okay, face shield and all. These are the first and the foremost most important things that you have to focus on. Okay, then coming to the nutrition aspect of it, it's in India, we usually depend upon a lot of vitamin C and zinc tablets to help COVID patients resolve their symptoms quickly. Okay, because by vitamin C, we are reducing the oxidative stress the patient has already undergone during the initial phase of COVID infection, when the symptoms are too much, high fever, flu, cough, okay, all when the symptoms are too much, your body undergoes a lot of stress, okay, physical stress as well as emotional stress. Okay, so to counteract that, vitamin C will help. Okay, zinc will help with the lymphoid tissues. Zinc will help the lymphoid tissue to make more lymphocytes for you. Okay, so that's the reason why we supply a lot of fresh fruits and vegetables along with vitamin C and zinc tablets to COVID patients. So vaccinations which we use in India, Covishield and Covaxins have been used in India commonly, most commonly. Okay, so it gives antibody reaction in the host because usually they are antibodies with somebody else's antibody is taken and given to the vaccine takers. Okay, so nutrition status is very important here. We have observed that people who have micro deficiencies, even if it is micro deficiency, they have a higher chance of contracting COVID as compared to people who do not have any nutritional deficiency. So about COVID, we do not have too much of research. Okay, still the researches are going on how we can nutritionally prevent the occurrence of COVID-19. Still researches are going on. We have a very limited information in the textbook. The last topic of your textbook, very limited information is there. So please just read it once, okay, and try to follow up with other articles what you can find online about COVID-19